Welcome to Healed Scars. Today, another episode of our video podcast. Not the silence zone. This is a place when we try to talk and be heard, when we try to explain a bit more about trauma and abuse. There is no interview, there is just casual conversation to engage you, to increase your knowledge, to make you feel better and more understanding your own behavior, your own life situation. Today we'll talk about trauma. My wonderful guests are Rachel and Dr. Derek. Hello.
Hi.
Hello.
Derek, if you don't mind, can we start from saying a bit more what is trauma and what can cause a trauma?
I guess we look at the word trauma, which comes from Latin, it means wound. So that implies it's more the result of something that's happened than an actual event or series of events that happen. So if there's some abuse, stress, or violence, this causes the stress. But I guess we have to think of why does this then become psychological trauma? So this might be that it's dependent on the situation, the way that it's interpreted, or the way that memories are later processed about the event. So I guess a distinction would be if you imagine it's not the simplicity of an event. So if you think of a boxer maybe receiving punches in a ring, it's totally different. If you look at another translation of the word trauma in Greek, they bring the word defeat into it. So I think there's a sense of not having empowerment in the situation is a big part of it, or imminent threat of death or serious injury. So there might be a sense of being trapped or being hopeless. And it's not just about a threat to self. Trauma can be from, a concern about harm to others. It might be something we receive from other people too when they talk about trauma, an event, that'd be called vicarious trauma. So it can happen even to therapists who are listening to trauma, can become traumatized.
And trauma seems to be something really very, very individual. So what I mean is like one event may not necessarily affect everyone. Is it something about individual perception, or someone is stronger or weak people take it more?
There's a lot in what you said, and that's a whole huge topic actually, and there's some debate about that. But yeah, so you're right. I think 15% of veterans go on to develop PTSD. There's one study I read that might be updated now, but so why is that? And there can be a lot of reasons. So sometimes being heard can be quite important, having a bit of a voice, feeling a certain level of empowerment or security. So in a war situation, if you're talking about soldiers, for example, sometimes the strength of the group can keep people quite secure, which can be reflected in connections within the therapy session. Just a therapy, a good connection between the therapist and the client can keep people feeling safe as they process and make sense of trauma. Also childhood events too. So if we're not very connected with ourselves from childhood events, which is a big topic, it may be that we're just never learned to really process trauma or be heard. So if we've never had a parent to tell, maybe when we were 4, something was happening, this can be something that causes susceptibility and vulnerability later in life to stress, and also to trauma, and also the level of being able to process the trauma as well.
We can actually recognize few kinds of trauma. Am I right? There's like few categories.
Yeah, absolutely. So there's sort of from acute trauma, which can be from a single traumatic event. If you are maybe attacked in the street or caught up in a burglary or something, and acute trauma can develop from a single event that's really stressful or dangerous to a person.
Mm-hmm.
And then you've got a chronic trauma, which develops from more of a repeated and prolonged exposure to highly stressful situations. So domestic abuse, abuse in the home, bullying, neglect, childhood neglect. If you've gone through that kind of trauma growing up, that repeated and prolonged exposure can lead to chronic trauma. And then you get into more complex traumas, which is probably more where PTSD and stuff comes in, that result from multiple traumatic events sort of happening, as opposed to over a prolonged period in a bit more of a quicker succession. But then, of course, as we sort of touched on earlier a little bit, you can get secondary trauma, which is relatively common or can be quite common in family members, friends, people who are experiencing the trauma, because they've got such a close bond, and can even extend to health professionals, doctors, counsellors, therapists, that feel that sort of secondary trauma for what the person's been through.
But how to actually recognize this trauma?
There can be quite a lot of obvious symptoms. There can be symptoms related to memories that are unprocessed. So from a psychological point of view, we would maybe look at specific things like attention can be affected. So let's say domestic trauma, and again, traumas, there's no such one thing, and there's a lot of different situations. Then it might be really important to track where people are. So this attentional change becomes a survival instinct. It becomes a coping mechanism. This can later on, which was a really useful thing at the time, but later on become a problem. It can lead to something called hypervigilance, where we're always checking. We might, for example, want to know where a partner is all the time, and it's useful at the time, but later on there might be relational problems, there might be relationship problems there. It could be attention deficits from some of the memories that activate too, that attention isn't really on the present moment so well. It's because some of the memories may be flashbacks, which aren't necessarily always visual. So there can be sensations, there can be sudden feelings of rage, there can be also changes in beliefs.
Ask for help, and if asked for help, where and how, and to do what?
I was going to say healed scars would be a good place to call first.
Good place to start.
Fantastic.
I think it's probably important to say here how vitally important it is when you're in a position that you feel that you need help, to get help. To start that process, whether it is going and seeing your doctor. I know that doesn't always lead anywhere quickly. There's a lot of people who need help and assistance, and I know that the services aren't always, there's normally long waiting lists for services, but quite often your doctor can then refer you on to other charities or local people in the area who can help or who could possibly help you. So your doctor is always a good place to start, and looking up local charities, I think.
And maybe we could attach some worksheets for these people. Would you be able to assist me with it? Something like the coping tools or...
Absolutely. So I personally am a student doing this, obviously the CBT, and cognitive behavioural therapy is filled with tools and exercises and things to get people to the level where they're being their own therapist. So there's tools and there's tricks and there's breathing exercises, things like that can help.
So one of the first things you want to do if in a specific, I think, to healed scars clients would be to get some safety and stabilisation. That's a key thing with trauma. There are some, like as Rachel said, the third sector is so important for helping people, and so some safety and stabilisation might be, for example, Women's Aid, who can provide the actual physical safety as well. So Then we might look at a key thing with, depending on the symptoms that you have as well, that something called grounding can be vitally important as a start, as the first stage to doing anything. And essentially that's looking at stabilizing and learning to live with some of the effects of trauma until some of it can be processed, maybe on a deeper level. So especially with dissociation and flashbacks.
Is it true that if trauma is overlooked, can lead to the mental health issues?
If something happens, a traumatic event, and it's not dealt with properly, and you're struggling, it can lead to if you then relive the event over and over and over and over, it then might grow into more of a complex or a chronic trauma, because you're reliving it again and again and again. Every time something happens, you talk about PTSD and you hear stories of fireworks and stuff going off, and these soldiers are sent right back mentally, they're sent right back to where they were abroad and fighting. So I think it's absolutely vital that if you are in a position that you're ready to get help, that you start that process, whatever that means for you, that you start that process to get some help.
Can we actually ever heal from trauma?
Well, that's a big question again. I guess what you've got to ask yourself is, can you ever overcome everything that's happened to you? So everything that happens to us changes us, doesn't it, to a certain extent? It can be dramatic, healings with people. Some people have different internal resources. For some people, it depends on the type of trauma. If it's very young trauma, can be healed quite effectively. In fact, a big thing can be the changes to our core beliefs about life. There's some very powerful tools for that. We can do that to level with CBT. We can do it with EMDR is very powerful. There's also other therapies, schema therapy.
So there are many therapies which can actually help to overcome the trauma, and maybe it wouldn't be a job done overnight. It would maybe take a while, but this is possible to feel better about
it's possible to have a different approach to trauma as well, to having a different relationship with it.